Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, we take a closer look at the NCDC epidemiology report as the country records more COVID-19 cases. The Taraba State Governor appeals to the federal government to establish at least one testing center in the state. In Latin America and the Caribbean record more coronavirus deaths as the pandemic accelerates. More states are recording COVID-19 infections, according to the latest figures released by the Nigeria Center for Disease Control, NCDC. The center announced 452 new cases of the virus, bringing the total number of infections to 21,371, with 7,338 patients discharged and a total of 533 deaths. The new infections are recorded in 13 states and the Federal Capital Territory, with Lagos having 209, Oyo 67, Delta 37, Ogun 36, the FCT 22, Abia 20, Enugu 16 cases, Bauchi 15, Kaduna and Ondo 8 each, Osun 7, Imo and Benue 3 each, and Borno State 1. States with the highest cases in each of the 6 zones are Lagos in the southwest. We have the FCT in the north central, the Kano in the northwest. River State has the highest figure in the south-south with 930 cases, while Bauchi once more tops in the northeast with 482 cases. Ebonyi retains its lead in the southeast with 264 cases. Let's take a deeper look at the COVID-19 situation report from the NCDC, and it does appear more testing is being intensified. The center puts the latest figures at 117,569 sample tests that have been collected. This is across the country. It also breaks down the number of infections across states. So far, the top 5 states are Lagos, the FCT, Kano, Oyo, and River State. At the bottom 5, starting with the lowest, in terms of the lowest numbers of confirmed cases, you have Kogi State, Taraba, there's Ekiti, Benue, and then you have Adamawa State. Now, since Friday, the 19th of June, Lagos and Oyo states have seen a steady daily rise in cases. From the reports of the 19th, that's Tuesday, 23rd June, Lagos has recorded a total of 281. Looking at that figure, Friday, Saturday, Sunday, you're looking at Lagos and Oyo states have seen a daily rise. And when you compare it to a state, for example, Kano has seen those figures as daily increases, but on Monday and Tuesday, there were no figures from that state. Well, let's try to look more into this report coming in from the NCDC, and while we're seeing a lot of dynamics with regards to the data. Joining us is an infectious diseases specialist, Dr. Abdul Jalil Tafawa Balewa. He joins us from Abuja studios. Welcome to the program.
Good afternoon, Millicent.
All right. Now, let's begin with looking at the epidemiological report from the NCDC. From April, since the first index case, to what we have now, the latest report as at the 22nd of June, there's been a huge difference, and this is in a lot of areas. What would you say we've learned about the coronavirus so far?
It's what we haven't learned. There's so much we haven't learned. I don't want to get overly excited in that now we're getting the figures much lower coming in. The last few days it's been close to 700, and last night I believe it was under 500. We should not think that we're on the other side of the bell curve as yet. We will wait to see what happens in the next few days. But if it is true that we're going down, we should thank our lucky stars and hope we continue in that trajectory. However, testing is still very, very, very small in Nigeria. We have 117,565. That's about 10% of what the United States has done, over 1,300,000. Considering that we're only about 2/3 of the United States population, we're way behind our sister countries even in ECOWAS, like Ghana. We need to double up on our testing, because I think there may be people that, one, may be infective but may not be symptomatic. Some may even be symptomatic, but we're in the season of malaria already, and there can be a mix-up there. We need to have a lot more testing.
Looking at the infection rate, you mentioned symptomatic, asymptomatic. I mean, we've heard the Minister of Health say most of the cases, community transmission, 80% are asymptomatic. And then the World Health Organization believes that the asymptomatic persons can transmit, but says research is still ongoing. How are we arriving at the level of our infection rate with the data on community spread as, you know, largely responsible by those that are asymptomatic?
It's very important for us to understand some things. When they say that somebody is asymptomatic, that person has been tested and the person is positive, their immune system is holding them and holding up very well, but they could be infective but not symptomatic. Somebody that's never been tested, you will never know whether they're infected or not if they've never been tested. It is very critical. When we just throw words around, it's important that even though we have about 60% of our population that can be regarded as educated and literate, all these large words need to be broken down so that they can understand, and people will be able to go to the different hospitals or commissaries nearby to get tested. If you have exposure, and the only way that you will know is if somebody around you has tested positive, then you need to go and find out if you are positive or not. The community transmission that we're seeing now, a long time ago, they used to think it was just for the rich. When you interview a lot of Nigerians, they'll say, oh, it's people who travel out, and I haven't traveled anywhere. I have been in Nigeria all the time. However, these people have people that work for them, and they have people that know people that work for them. Imagine a few weeks ago, when the Almajiris were being moved around, some Almajiris went into Kaduna. About 10% of them were infected. How can that be possible? They've never traveled anywhere. However, they're always in contact with people in places where they will be able to get their daily bread. Like the mosque is where the people that may have been infected go to. Now, if they just move around, not knowing what their status is, that's very dangerous for the entire population. And
Dr.
until
Tafawa
we get more testing done, yes.
Infection rate still hasn't peaked in many countries, and that includes Nigeria. When will we be able to tell?
Well, as I mentioned earlier, we have something called a bell curve, which is like a hump of a camel. Knowing that you've been hearing this expert saying it is still rising. However, when we get to a peak, you will know, because we will constantly be having fewer and fewer infections until it gets almost to the point, the asymptotic point of where we started out with our index cases, and that's still some time in the future.
All right, we'd like to thank you, an infectious diseases specialist, Dr. Abdul Jalil Tafar Balewa. Thank you for joining us on the program.
Thank you for having me.
Over in Taraba State, Governor Darius Ishaku is appealing to the federal government to establish at least one testing center for coronavirus in the state to sufficiently ascertain victims of the virus. According to him, if there is a testing center, it will be faster and easier to test and get the results and those affected treated or managed. He adds that the processes involved in taking the samples to Abuja, awaiting the results and returning back to the state is tedious.
If I have a lab here and I test maybe 10,000 people, I'll be able to tell you, oh, 10,000, 10% of the cases are positive. So I will tell you that in Taraba, maybe there are 10%. But for now, we don't have a case. But that is full of question mark. It's not scientific. It's because nobody has come forward, and because all those that we've tested have gotten negative. But the test has to go to Abuja. It takes a long while to come back. I'm pleading that the federal government should help us. Let's have a center in Taraba. I think we need to do a lot more to reduce the rate of infection.
Over in Enugu State, the governor, Ifeanyi Ugwuanyi, has granted task relief and incentives to taxpayers in the state as part of efforts to cushion the effect of the coronavirus disease on residents. The chairman of the Enugu State Internal Revenue Service said the waivers are part of the administration's pro-poor policies and will be sustained till the end of the tenure. The Speaker of the Kaduna State House of Assembly, Mr. Yusuf Zilani, has directed all its members and staff to undergo a compulsory coronavirus test with immediate effect. The Deputy Chairman of the House Committee on Health told correspondents that the test has become necessary after a staff of the Assembly tested positive for the deadly virus. Although 9 of the lawmakers have tested positive, he explains that it has now become compulsory to ensure that none of the members and workers are infected.
A staff in the office of the clerk, it was tested and he was found to be positive. And he has since been isolated. He is already in one of the isolation center. That is the position I got. And at the same time, in the wisdom of Mr. Speaker, he has given directive that the entire workforce of the Assembly be subjected to COVID-19 test. And that's the exercise going on as you saw staff converged this afternoon for that exercise. So that is going on and until they finish. But I'm most quick to let you know that the House has not really returned to full work. We are still having government directive for the offices to remain shut, but because of certain exigencies, we had to come for one or two activities of the House that had to do with what took place on the 11th of this month.
Still to come on the program, Benue State Action Committee on COVID-19 gives an update on its management strategies. Do join us again. The Benue State Action Committee on COVID-19 has denied the death of a COVID-19 patient at one of its facilities, noting that the deceased was operated for cancer of the bone and later started coughing 3 days to his death while the sample was taken for testing in Abuja. The chairman of the committee, Mr. Benson Abono, today, responding to the issue, said the patient died on Monday morning and his result came back positive that evening, making it difficult to tell the cause of death especially while battling a complicated health condition. Mr. Bono also confirms that 3 medical doctors, 2 drivers, and another health worker all tested positive in the course of responding and managing COVID-19 patients, and their numbers have risen to 47. He also disclosed that the Northern Governors Forum have ordered for 25 mobile testing trucks to help curb the spread of the virus. The Yobe State government, in collaboration with LAFIA, a United Kingdom health support program in Nigeria, have sensitized journalists and civil society organizations on the prevention and mode of spread of the disease. Governor May Mala Buni, who was represented by the Commissioner of Home Affairs, Information and Culture, says many individuals had contracted the disease unknowingly due to ignorance. He commended the journalists for playing a vital role in the fight against COVID-19, especially in the enlightenment and mobilizing communities, but adds that there needs to be done a lot more, especially giving the right information.
Journalists and media organizations have played a very important role in the fight against the COVID-19 pandemic and in mobilizing communities for action against the disease. The work that journalists have done and that they continue to do is very important, and we want to congratulate them for what they have done so far, and we want to urge them to continue to work harder and ensure that people have the information that they need to protect themselves and their families against not only COVID-19 but against all other diseases. COVID-19 is especially important because this is a disease that spreads very quickly in ways big and small. So it's only information, the right information, that will help people prepare themselves and guard themselves.
We have a public health physician, Dr. Osinachi Ubani. She joins us here in Lagos. Welcome to the program.
Thank you for having me.
All right, let's start from just the last story there. How effective have government, community influencers, the whole society approach been to help perhaps dispel some of the rumors and more put out the right information on how to reduce the spread, curb the spread of COVID-19?
Handling rumors has been an uphill task, especially when sometimes you can't even say where those rumors are coming from. You find people just sit in their homes, fabricate something. I understand that a lot of people may not trust government, but we should also realize that this is a brand new virus. Some things that were true yesterday, last week, would have changed a little because every day studies are going on, new ideas are coming up, new findings are coming up. But with sensitization from the part of government and from the part of the responders, and putting out regular and consistent information out there, it will help. It will go a long way to let people, if they get the right information, then it will be easy to disagree with the rumors when they come up.
So according to the NCDC, women and the elderly appear to be at most risk of rumors or worst hit by the gap in awareness.
Well, I wouldn't say I totally agree with that. But because, of course, women are a lot more vocal, they're also the ones that seem to have a little extra time on their hands. It's generally believed that the men are busy, they are doing other things. So you may say that, okay, so because they are home, they are with the children at this time, they may have a little extra time to go online, participate more in social media. But most of these rumors we even see are anonymous. So you can't even categorically say that, okay, no, a greater percentage of them were raised or brought on by women and children.
All right, let's look at our non-pharmaceutical interventions. So far, the PTF has talked about risky behaviors that appear to be a challenge to handling and reducing the spread of the virus. How are we doing with that?
Because this virus is, will I use the word, not completely, the fatality rate is just about 3 to 5%. So a lot of people are still in what I'll personally call denial. Many people still don't believe that there is something like coronavirus which can kill. And then because we're not seeing people get very ill, fall down, the statistics is that out of about every 10 cases, maybe only one will have a serious infection. And then you see people who are apparently healthy, they are looking all okay, no headache, no fever, they are eating well, and you say they are positive. And then the neighbor is watching them do everything normally, and they don't just fall off and die. You know, during the time of Ebola, where you saw cases vomiting blood, stooling, very weak and all that, everybody was panicking and we tried to do the right thing. But at this time, when we're seeing many of our cases asymptomatic, a lot of people seem to think, it's a ruse, you know, why bother? So you find people doing things like, okay, they say we should use face mask, but they don't necessarily believe that the face mask is helping. It's in their pockets, it's on the chain. I've seen some on the forehead, you know, and then wash your hand. But the solution is information, sensitization, because no matter how well some of the positive cases are, they are still shedding the virus. And you don't know whose immune system is weak. We don't know who has other comorbidities. We don't know who is going to die from the virus. 3% looks small when you talk about it in percentage. But we're talking of about 22 million people in Lagos State. And then you talk about 3% of 22. And that's a whole lot in terms of numbers. So I think some of these non-pharmaceutical directives from NCDC, from PTF, should be taken very seriously. And one way of doing that is to have that continuous sensitization, motorized rallies. Let the government, let the responders keep putting that information out there.
All right.
You know?
We'd like to thank you, Dr. Osinachi Obani, a public health physician. Always a pleasure.
Thank you. Thank you.
There is continuous worry over Latin America's fight against the virus, as deaths in the region have surpassed 100,000. Health experts are saying infection rates still haven't peaked in many countries in the region. In the meantime, global number of cases now stand at over 9.2 million, with 477,807 deaths and more than 4.6 million recoveries worldwide.
A tally of figures collated by Johns Hopkins University shows that the total number of virus-related deaths in Latin America and the Caribbean is now more than 100,000. More than half of these deaths have been reported in Brazil, where case numbers continue to be among the highest in the world, behind only the US. Mexico has over 23,300 fatalities. Both countries have taken less severe lockdown measures than many other nations, and neither has imposed nationwide restrictions. Peru and Chile have also been badly affected, with 8,404 and 4,505 deaths respectively. Latin America now consistently reports more daily cases than the US and Europe, and experts say the peak of the pandemic in some countries is still weeks away. Tokyo's new coronavirus cases climbed to 55, the highest tally in 1.5 months after a cluster of infections was found at an office in the Japanese capital. The metropolis, with a population of 14 million, has sought to keep new cases below 20 a day after Japan lifted a state of emergency on May the 25th. And in Belgium, with impersonal anti-coronavirus masks rapidly becoming items of everyday use, a businessman decides it's time to give them a human face, literally. Using a photo booth, software and a mobile phone app, Charles de Belfroid is producing masks that have the lower half of the wearer's features printed on them.
You can visit the NCDC website. It has regular updates on the COVID-19 regulations and guidelines. Loads of information that you need. It keeps saying that every new case is motivation to keep pushing. Its recovery is proof that we can get through this together. It's also asking Nigerians to take responsibility in protecting your health. From the World Health Organization, you'll find the coronavirus disease situation. The website has rolling updates on the pandemic. You can take a closer look at some of the numbers as well in real time. Our website, channelstv.com, has the latest news. All you need to do is log on and you can find the stories there. You can see Nigeria's new confirmed cases, also other stories in politics, sports, business, news from Africa and all around the world. channelstv.com. That's our COVID-19 update. Thank you for watching. I'm Millicent Wonwoka. Stay healthy.